so we're going to now demonstrate how to tape for an MCL sprain. This would be great for an athlete who sustained an MCL injury and is now ready to return to sport. You want to make sure that the ligament is healed, but this would be just a little extra support while they're returning to play. We're going to start with tough skin. The anchors are going to be across the top of the gastroc, and then you want your proximal anchor up here, kind of like mid to lower thigh. So go ahead and spray. So we're going to go ahead and do the anchors with 3-inch. Make sure that the athlete has got all their weight on the leg that you're taping. Whenever you're going around the muscle, you want to make sure that their muscles are contracted. And get the athlete to lift their heel, put it on a roll of tape. So now we've got our gastrocs contracted here while we do this anchor. And then when we're in the lunge position here, we've got the knee flexed just about 5 to 10 degrees in order to protect the MCL. And when the athlete has all of their weight on this front leg, you should have enough of a contraction through the quad when you go ahead to anchor. So that contraction looks good. We're going to anchor well above the joint. You can see that you want to make sure that the joint is clear from this point. So your anchors need to be well above and below. So when we create the support going through the middle, they've got a long fulcrum here to kind of give it the most amount of support. We're going to use a thicker elastic. This is a much denser woven elastic tape. And once again, we've got 2-inch and 3-inch. I'm gonna go ahead and use the 3-inch. I probably could do either for the size of this leg, but I'm gonna go ahead and use the 3-inch just to make sure we've got a good support base. So the first one, you want to landmark it right through the middle of the joint, okay? So the first one is gonna go straight up the middle, okay? Now you'll notice that what I'm gonna do here is I'm gonna secure one end of the tape. I'm gonna cut it in place, but I'm not gonna secure the other end until the very end when I can actually get a maximal stretch, okay? Because we want this to be really supportive. We're gonna go ahead, secure that one end down, hold it in place, and really you wanna get maximum stretch. So pull up on that, and then you're gonna lay it down, okay? Now in between strips, you can go ahead and use some zinc oxide just to hold it in place. And so if we're gonna do that in between strips, you just go across and add a couple strips here, and that will help keep your strips from coming loose while you prepare your next one. Okay, so then the next one, we're gonna do it at a slight angle. So we're now gonna create an X across this. So we're gonna start slightly posterior, cross in the middle, so our cross should be right across the joint line. So hold that down. We're gonna cross and then finish more anterior. Again, the first time I put it down, it's loose, but then we're gonna go ahead and secure it after that. So we're gonna hold that end in place. Try to get 100% maximal stretch and pull up and then secure, okay? And again, we can do a couple strips here. I'm not going around the full leg with this zinc oxide tape because it's muscle and I don't want to cut off circulation there in any way. Okay, and then I've got one more strip to do to complete my MCL support. So now we're gonna start slightly anterior. Okay, still crossing right across the midline of the joint, and we're gonna end slightly posterior. And once again, hold one end down, really pull up to maximal stretch, and then we'll anchor the two ends. Okay. So once you've got the 3 strips across the MCL to offer that support, then we're gonna repeat our anchors and make sure that this isn't gonna go anywhere when the athlete returns to play. So cover up the ends of the tape. Again, make sure they have all their weight on that front leg, just to make sure that quad muscle is contracted. There we go. So there's your MCL support.